Great. Thank you, everybody, for being here. My name is Stuart Schlossman. I'm president and founder of MS Views and News. Today's program is sponsored by Bristol-Myers Squibb, and internationally, we want to give them a virtual round of applause, all right? I want to thank everybody for being here and thanking them for, helping us to do today's program. This is about wellness, all right? This is the MS Wellness Summit. We do this periodically. Today's program, again, it's an MS Views and News program. All right, so our next presenter is Marilyn Volcker. Marilyn Volcker is a sexologist. She's a sexuality educator for the past 50 years, everybody. 50 years, okay? She's a diplomat of the American Board of Sexology and an associate fellow of the American Academy of Clinical Sexologists. I'm not going to read a lot about her about her bio, but she has been doing these things for so long. She's accredited with starting the Health Crisis Network, the Institute on Sexism and Sexuality, intimacy programs, and so much more. She's been on the Barbara Walters Show. She's been on 2020. She's been on Larry King, and evidently she's got enough there that she made it onto all those programs. So let's welcome Marilyn Volcker, who's going to speak to you for 30 minutes, and we will then do a Q&A. I hope you all enjoy what she has to talk about. Marilyn, remember to look at the screen. Thank you.
I have to have these directions, kind of like sex. You got to have these directions. Okay. I'm very happy. First of all, I want to thank you. Everything that your presenters said, and I want to thank you both, Stuart and Bill, and all the people who've helped you. All of your presenters, and I'm glad I'm the last one, even though people might be ready for lunch or who knows, or sex, is that I want to just say everything they presented helped in expressing sexuality, body movement, breathing, all of the things that learning about your body, pharmaceutics, those are so important in sexuality and MS. So if I don't get through this whole PowerPoint, please, it's going to be available to you as well. So I'm not supposed to say, next slide, I'm supposed to say something else, and I forgot. But there I am. And I just want to say, having worked with so many people with body differences, I learned a lot. You are the real experts about what's going to work best for you in your personal life. And it's important to be able to talk with somebody as well. So my background's in special needs, and just to let you know, my husband and I together 42 years. He has diabetes big time. He has high blood pressure. So we've had to adapt. And guess who we learned from? People like you, real experts. So the next slide, moving forward. Okay. I want you to know, when I listen to the speakers, I was teaching this morning at a university, but when I listen to the ones, they all have your heart. And that's what we bring into our sexuality. We bring our brain, absolutely, for sure. And we bring our heart. And that's a very important part. Okay, moving on. So this is from Carolyn. MS means multiple sclerosis, many scars, many struggles, many symptoms, modified sexuality, more spirituality, mighty strong, much success, many successes, much support, my story. Real expert. Moving on. Here are real experts to me. And when I ask them about how do they show closeness and intimacy, and only one is genital sex. Oh, who said you can't be close in a chair? Who says you have to get out of the chair, walk to the bed, because by that time, so fatigued, holy cow. And so who said you can't do things in a chair without taking off everybody's clothes? Well, those are real experts like you from the MS groups. Thank you, all over the world. Okay, and here's some more. Moving on, to be close. Genital sex is only one type of closeness. And when I speak, some people are going to get shocked. I'm very clear. Well, I say eyelid, eyebrow, eyelash, okay, elbow. So I'm going to say penis, scrotum, anus. I'm going to say vulva, vagina, clitoris. And so I name the body parts. But for people who may not, and by the way, I don't want you to think I grew up in a loose home. My father was a minister. We never talked about anything except he said, nothing nasty on your body. And my uncle, the Marine, said, you better learn about it so nobody tricks you. So I'm glad you're having this conference to learn about it. Some people go, I know, I already know this, and thank you for that. I hope you have. Oh, and by the way, when I started 50 years ago, there was one book with two little paragraphs about sexuality. But if you Google sexuality and MS, oh, I'm so glad. I'm going to be commenting on some of it. There's so much information, again, shared by people who are going through living with MS and their partners. Or if you're single, there are apps for people who live with different body challenges to date. Just saying, if you're interested. Now, some people get like, I don't want to talk about sex. Well, I'm talking about intimacy, which is closeness. There's 8 types. Only one is sex. Oh, I teach deaf people, so you're going to see me sign. Okay. And some people get upset. Why do we have to talk about it? Because you were given a sexual response. And some people get upset and angry because they miss what they used to do. And other people go, I'm going to be finding out what I can do. Now, some people joke. Oh, I've been told a lot of jokes. And I don't remember most of them, but some people laugh. And I understand. Embarrassed. This, if you ever had anything bad happen to your body, anything, I want you to go get help, because that's trauma. And the disease can be trauma, and also things that can have done to you. So I want you to always know there's trauma counselors as well. So moving on. So Joanne and the doctor. Joanne is the person who lives with MS. She said, I was fearful about talking to my doctor, and I was fearful about talking to a partner. My belief was I'm damaged, and her comfort was 0 until she met other women. Oh yeah, no embarrassment. There's one called No Embarrassment, Women Talking About MS and Sex. Absolutely, and no shame. It's called No Shame. That's it. Next slide. And so kissing is one. You don't have to be spending a lot of energy taking off your clothes, okay? You don't have to spend a lot of energy getting out of a chair, people are telling me. A lot of people say, by the time I did all that, I wouldn't be even up for anything. So that part, how you show affection, this is called affectional intimacy. Doesn't have to end in sex. Moving on. By the way, all of these people that I'm showing you the pictures, they live with MS, all right? So Joanne and the doctor said, oh yeah, have you noticed any changes? Duh, yes. And so her feelings and responses are, yes. Desire, which can be for men too. Vaginal atrophy and dryness. Oh, lack of erection. If it's a Joe, we can have Joe and Joanne, okay? Whoa, lack of ejaculation. Whoa, tiredness. Yes, and the minimizing, but fatigue and discomfort. So finding just times to be close. I was working with a couple where one of them had MS, and they said, our go-to word was TBC, to be continued. And what they learned is they could start, and it doesn't have to be a marathon or work, because work is too much work. The need for more, less, different stimulation. So there's something called body mapping. And body mapping is where on my body do I feel more? Neuropathy can, cause, I don't feel so much, although some people say, I like the idea of somebody touching my body parts, genitals they're usually talking about, private parts. I may not feel it, but I like the idea because thank you very much. Everybody's talking about the brain. It's the brain that's the biggest sex organ. Absolutely. And of course, peeing. Yep, urine. Okay, I'm just going to say this. Unless you have a bladder infection, urine is purer than spit. Please do not go home saying that Volker thinks we should be peeing on everybody. No. But sometimes with some medications, or sometimes people don't care. That's why they put a towel or have an aide or assistant put a towel down. I had a couple, one who lived with MS said, we went in the shower. And that's where we were close, because then we could wash off whatever. Very interesting. They found what worked for them, but they had to communicate. And the and is they had to communicate. What has changed about my sensations and all of the people that you've talked to in the questions? Not only genital sensations, arm, leg, neck, face, absolute balance? Yes. So maybe I can't be on top, on bottom. Maybe we have to find the right place for where I'm feeling safer with balance. Energy, when's the best time? Or do we stop here? And this is important to communicate. Where is my mood? I want to talk to you about this one. There are two very different types of sex response. And one is from Masters and Johnson's, where they said, you had to have a lot of high sex response. Well, not everybody does. And you had to maintain it. Not everybody does. And you had to have orgasms multiply and simultaneously. Work. If you're so lucky, grateful. But along came a doctor, and her name, Dr. Rosemary Basson, Basson. And her sex response is like a circle. And she said you could enter into sexual neutrality. That didn't say aversion. So if somebody says, hey, you want to have sex? Well, maybe. And then you find out what's the best way for your body to respond, but you always know it doesn't have to be work. You get to where you enjoy and say thank you, and say thank you. And that's where communication is very important. Some people can be less responsive, less initiating, because often people's emotional part, 3 reasons for a sex response: physical, psychological, pharmaceutic. And I'm glad you covered that all already in your conference, is that, oh, that's why. It's not because I'm bad and terrible or not pretty or not handsome or whatever. No. I could be less responsive, and let's see what ways that I really like. And maybe my partner wouldn't want to be with me. That's a big concern for Joe and Joanne and the doctor. And is that normal? This was put together by women with MS, but I've talked to lots of guys with MS as well. Well, what do other men do as well? So we'll talk about some of those. Moving on. Well, is sex can be different now? Yes, it can be. It can be. All right, you're on plan B. So for guys, if they don't get an erection, we're going to see some guy slides. But all right, okay. Let's see what can be done. If women have dryness in the vagina, let's see what can be done. Water-based lube, pelvic floor. If I get scared, and it's called vaginismus. Okay, pelvic floor therapists. And for guys, to maintain an erection, if they get it, okay, is there something called, I'm going to give you the medical name, and nobody talks like this, venous O retention ring. Yep. Nobody talks. It's called a C ring or cock ring. And you put it at the base of your penis. And it keeps the erection. Keeps it. Also keeps a condom on if you're using that. Okay. And so, yes, sex can be different now. And you can enter sex, remember I said, in sexual neutrality, and see what you can enjoy. And see what body parts, body mapping, that your brain will interpret as, I like that. Moving on. Will I be able to have orgasms? You want to see the best way. That's caused by your autonomic nervous system. And remember, people are talking about the brain and all of this. And your autonomic nervous system is responsible for coughing, sneezing, passing gas, whoops, and orgasms, which is a muscle contraction. So some people have little, I call them butterfly. This is sign language for butterfly. Butterfly, little ones. Some men who take medication, who live with MS, they will have retrograde ejaculation. That's when the semen goes back in the bladder, broken down, and they urinate it out. You can't see it, but they still have the muscle contraction. Absolutely. Autonomic nervous system. So a lot of guys joke, believe me, got to have a sense of humor sometime, is joke about I'm in pre-puberty. Holy cow. Holy cow. So that is important to look about. Who is the doctor and who's the counselor that I would trust talking about this? And I want to talk to my partner if I have a partner. And I want to date somebody who would really understand some parts of body challenges for sure. Moving on. And here, would they understand? Well, if they're not going through it, they can't really understand. They can't. Okay? However, they can accept and see what's possible. Let's see what's going to work. And that doesn't mean everybody's happy all the time. There's grieving, there's loss. Let's see what's possible. I agree with the previous presenter. Anybody who lives with life challenges, I think they're amazing. And I think you all are amazing and teach us all about Plan 47 maybe, but surely Plan B. All right, next slide. It can be painful. It can be painful. And that's why you want to see a pelvic floor therapist, somebody who knows MS, and you want to be sure to use water-based lube, and also there's dilators, graduated dilators made by a nurse. And she made them, they're called Soul Source, SOULSOURCE, and they're graduated so that you can put water-based lube on, squeeze, relax, and see how far. I was working with a couple with MS, and he said, well, I can't do the deep diving anymore, but we sure like the shallow diving when we can. All right, absolutely, for sure. That's what my husband and I learned as well. Just to let you know, my husband has not gotten an erection by himself. He's okay if I say this. We've been on panels together. He's not gotten an erection since he's been 47. He's 80 now. He only gets it with a shot directly to his penis on the side, not on the bladder side, on the side. And could last for an hour. I might take 10 minutes. But you've got to have a sense of humor about this sometimes, and also grieve, because balance, pain, nothing to joke about. However, that's one of the ways to cope, talking and seeing. Oh boy, for sure. I was talking to a couple where the woman was living with MS, and she said, our joke now is, whenever we bring something up, she goes, well, it depends, because she has to wear Depends. And they found, okay, let's find what works. And I can be mad, I can grieve, and yet I want to see what works. Then moving on. I just want you to look at this. There are 8 types of intimacy. Only one is sex. Some people can have a lot of sex, rotten relationship, or not as deep of intimacy. You can show affection in different ways. And I was talking to a couple, and he was in a chair, and she said, we like to go for walks, and we like to smell things in nature. And that was their social intimacy, their affection, to talk about their feelings, even if they didn't like it, understand, or wanting to do everything. They really wanted to share their feelings. Intellectual, learn about MS. I'm glad for all the questions. I am so honored to be a part of this conference where we learn a lot about MS, which we didn't know before. Oh, for sure. And also spiritual. It could be religious, or it could be, I want to work out at a gym so that I feel 100%. And by the way, that breathing and that working on body muscle, that's really important for sex. Absolutely. It's called tantric sex. I'm getting to the sex part, but it's called tantric. More spiritual. Eye gaze, breath work, seeing on the body how and where you connect now. Physical is not sex, what you can do together. That's what I was telling you about this couple that like to go out in nature. Aesthetic is not your butt. The young people with MS call it like the butt thing, Marilyn. Aesthetic means sharing something beautiful. What's the most beautiful thing that you share? Could be with your family, with friends. And I loved what the former speaker said about community. With your community. Communities could be. And here's sex. Outer and inter. The teenagers call it outer course. They call it skin, not in. Okay? And intercourse would be in the mouth, in the vagina, or in the anus. And there are a lot of guys who say, I can't maintain an erection. Viagra doesn't work for me. It doesn't for everybody. And remember, I'm not against it. It worked for my husband for a little while, and then it didn't as his diabetes advanced. But remember, if you take it, and by the way, we spoke for Pfizer, so I'm not against them for, but when it didn't work, when you take it, it's going to vasodilate face or chest. It's a vasodilator, okay? And the only way he found he could get an erection at 47 was an EpiPen to the side of the penis. Now, most of the guys listening is going, oh, I don't like the idea of a shot to my penis. And remember, I'm a woman, so yeah. However, if you could get more of an erection, would you go and talk to a urologist who also knew MS and see about that as well? Those are the 8 types of intimacy. Only one is sex. And moving on. All right. She may not have a headache, but she might, because a lot of people with MS do get headaches and pain. She might be tired. She might be mad. She might be grieving. He might not know what to do if she's living with MS or vice versa. That's why you do want to seek out couples counseling to see what's our plan B or 47, all right? And you want to be sure that both of you, if you're in a relationship, get support. If you're single, you want to find a person that you don't have to keep talking about MS. I know. You want to enjoy some other things in those intimacies. All right, moving on. Well, your desire for sex have decreased because remember, desire is a brain and hormone thing. And MS can affect that. So that's why Dr. Rosemary Bassan said you could enter sex in neutrality and then just see how your body responds. Because if somebody said, hey, you want to get it on, the honest response could be, but I'm willing to be close and see what we can share. That is a very challenging conversation and yet a very depth of intimacy conversation. Moving on. Oh, well, the speakers have talked about energy as well. And so you don't want to think, if I start and we're close, I have to keep going and going and going, because that's work. That's work. Let's see what we could share. And let's see what I liked and what you liked and what Well, okay, we could continue in a different way. And do we want to continue something in a different way? Do we want to use a toy? Toys. I did not grow up in a toy era. So I'm 75. All right. And you know, the interesting thing, though there are some wonderful toys that are put on the market absolutely for people, and some of them are also made for people who cannot reach. So there's a reach with a vibrator attached, especially if somebody has small motor coordination problems, okay? And goodvibes.com, take a look at some of them, and for sure you want to see when the last speaker was talking about pelvic and hip and muscle problems, well, of course it would decrease your energy to think about, holy cow. And so some people look at the toys that are available. Next slide, please. And here are these expectation versus the reality. You teach so many people about how challenging it is. And also, what's the plan B in 47? Will my partner find me attractive? Can I be a good lover? And my answer is yes. Because if you adjust what being a good lover is, to receive and to give, I like this. I really was turned on. If you can flirt when you're in energy space, okay. And let's just do what one of the couples, where they both were really dealing with MS, they said, sometimes it's just called sleepy closeness. Just like, okay, that's what we can do. Will my sex drive, energy, and erection last? Well, doesn't always. It can move, it can shift. And remember, we talked about the erection, that C-ring, if you want to utilize that as well. By the way, if you use the C-ring, it also means you don't ejaculate until that ring, somebody puts their finger in there or it's taken off. You don't wear that ring all night. This is not a party all night. Oh, I need to look into this space. Okay. And you can have orgasms. They could be different. Some people said, I used to have these like solid orgasms, and now they're kind of like, ejaculation? Well, I don't ejaculate now. It might be retrograde, or as one of the guys with MS said, I got to pull the wastebasket up farther. His joke. How can I have a sex life when I'm so tired? I would say, sleepy sex, tired connection, start there. Tired closeness, start there and talk about what you like. What continued? Will my partner continue to love me? You know, it's so interesting because I know that's a fear by a lot of people. However, when there's communication and when you're talking to your communities and your partner talks with other partners so their feelings are validated, that's it. What if I lose bladder and bowel control during sex? That can happen. And unless you're into urolagnia or coprophilia, those are the medical words, it's like embarrassing, yes, which is why some people do not drink a lot if they know they're going to have sex, or be sure to have their bowels emptied, okay? And by either medications is that they try to do. And if it happens, yep, it can happen. It can happen, I know. And it's not something we choose or want, but it can happen. How much should I tell a potential partner and when? Well, as I said, there's some apps dating for people who deal with any kind of diseases. And the when is up to you. Some people are right up front. I live with MS. I live with diabetes. I live with cerebral palsy. And they just say it. Can I get pregnant? Well, that can happen, but pregnancy is a big issue for a lot of women with MS, okay? And who is going to be my support in this as well. How will I tell my partner feel if I suggest different sexual routines? Well, my hunch is that you have been having different routines in living with MS. So if you talk about different routines, and then, yes, there's the sexual part. And each of you could miss that. Yes, you could, and it's all right. And it's all right. And yet there still can be love, and let's see what's possible. How do I get interested in sex when I'm dealing with everything else? You're correct. You may not be interested. You might be willing to be close. So do not put it always on yourself. I have to feel sexual. And by the way, it's not going to be like adult films, which we call porn. They are great fantasy material, not always reality material. SexSmartFilms.com has some films of people who are dealing with medical challenges. So you might want to check out SexSmartFilms.com. Okay, how can I get people to see me as a sexual person and not just thank you? Because you want them to see your interests in life, even though it's challenging. You want them to see that you're still interested in either being close or flirty or, oh, I still would like that. Would you be willing to see what's possible? And that part, and I've worked with lots of people who, oh my gosh, said, there's a couple I just have to tell you, they had debilitating arthritis. And they said, we don't get into bed. We don't even wear underwear on those days. Too much time, too much effort. And if we just body rub, it's okay. By the way, that's a very pretty word called frottage, body rubbing. Moving on. And so there's an app, Sex Tip for Women with MS, and one for men, and one for men. Next slide, please. And these are some of the, love has no labels, because there are women who are attracted to women, men who are attracted to men, who live with MS, and bisexual people. And bisexual people, just a comment, could be in an opposite sex relationship, and oh yeah, bi-straight. Or they could be in a same-sex relationship, bi-gay, or bi-bi. Okay, next slide, please. So here they are at the sex therapist. When I touch him, he just rolls into a ball. This is where a picture I wanted to show you, Michael, who was diagnosed with MS in 2014. And it's on the cover of one of the MS pamphlets. And I love to see how men and women and partners and whatever deal with. So it looks like Mr. Pillar, who might be living with MS, is afraid. What if I don't respond in the same way? Okay, you can do sexual things without an erection. He'd have to adjust to it. Partner would have to adjust to it. Okay, so if he doesn't ejaculate, well, then he'd have to say thank you. And by the way, there are some women, by the way, who are so happy not to sleep on the wet spot anymore. Just saying. I've taken thousands of sex histories. All right, next slide, please. And yes, these are changes. Directly, effects on sensation, movement, which the last presenter talked about the way to get and see the best type of movement. Depression. When people are depressed, and I understand, they don't really feel like having sex. Brain injury and altered sex hormone production, absolutely, because it's our hormones, the hypothalamus, who tells the pituitary gland, go send down sex hormones. Well, they can be changed. They can be changed. Elevated levels of prolactin, nerve damage, of course, that would be indirectly. Desire, age, psychologic, might be about some other things as well. Social, emotional. I can't do what we used to do. We used to go on dates. We used to go, I'm talking about before pandemic, but emotional stress, meds, fatigue, distraction, oh, and a combination of both and partner, direct and indirect. That's why I like couples group, okay? And also where people talk to each other about what it's like to live with MS and what it's like to be a partner with or without MS. Okay, moving on. And look at all of these things in the research. That's why it's so amazing, amazing. Yes, if you have a loss of sex drive, remember, you can enter in neutral. So the question would not be, hey, you want to get it on? But the question would be, how would you like to be close and what time of the day? And so, and direction, vasocongestion, okay, absolutely. I already said my husband hasn't gotten erection unless he has a EpiPen shot to the penis. And some guys use a pump and then put the C-ring on. You'd have to see what would work best for you, okay? And people can actually have sex with half erection. Wow. Decrease or unpleasant genital sensation. See, you want to see unpleasant. Okay, you want to see what would be more close, more feeling close. Lubrication. A lot of people have differences in lubrication. A lot of women look at those water-based lubes, okay? And the capacity for orgasm or anorgasmia, not being able to. And a lot of people feel then they have to fake. You just say thank you, TBC. I can't tell you how many. We heard about the bowel and bladder. We heard about fatigue. We heard about muscle weakness, especially from many of the presenters. Body or hand tremors. One of the people, I have to just say, one of the people who dated a person who had MS thought they were having orgasms when they had some spasticity. And the woman said, well, I get them sometimes without sex and sometimes with sex. So they really had to talk about that. You have to feel very comfortable and confident. I'm like impressed. Attention, focus, concentration, because I may be done and need to go to sleep. And sensory changes that are non-genital. My psychosocial, my culture, what was I taught? Myths regarding diseases and sex. I just have to tell you about this one gentleman when we taught at the medical school. His name was Saul. And he was paralyzed from the nipple line down. And he couldn't use his hands very well. And he was talking about sex with several girlfriends. And one of the medical students said, Saul, I don't mean to be rude, but how can you have sex? And Saul looked at him and said, my brain and my mouth still work. Now you figure out the rest. So you can see how self-esteem and, let's work on strategies. The roles of partner, care provider. If somebody is more of a care provider, and I appreciate this, it's hard to move into the sex part. It's much better sometime to get help or with that, and with that as well, or to have a time when you're not the care provider. Okay, loss in jobs, profession, absolutely, and stress. So we're coming, I know, close to, we need to be finished, absolutely. And next, let's see what else we got, because if I don't finish this, you're going to have this, oh yeah, no sex, please, we're married. And so some people use that as I know I got MS and it's changing, but we're married, we don't need so much. Okay, next slide, please. And here, expectation of dating and sex said, I have to be able to say what I'm going through. Body image, yes, and it's important to talk about that and the changes. Fear of rejection, I have to prepare. Somebody may not be ready for that. Well, what are you okay with? Balance, for sure. Mobility, and what I used to be able to do, can't do. Adapting to the walker or the chair, One of the couples who, she was on a walker, she said, we found we could do sexual things and I'm holding on to the walker. Doesn't mean I have to be in bed. I don't even have to take off my clothes. I just kind of, he'll pull down my underwear. See how amazing people can be. That means they have to communicate. Living situation in privacy, and I get it, because some people don't have that privacy. Attendant care, privacy. I belong to an international sexology group, and in some countries, the attendants do wash, place the couple together, and then come back after to help them after sex. Okay, myths about MS abound a lot, and about sexuality and when to disclose. Minorities, cultural, religious, GLBT, worked with everybody in differing groups as well. Okay, moving on, because we got to get through some things. Okay, you don't want to ask, did you like it? Was I the best? Okay, because the answer are yes and no. And oh boy, moving on. Much better way to communicate when you're ready. What did you like about Plan B? What didn't you like so much? Well, I missed this. Okay, yes. What would you change? I know I don't want to have MS, but do you want to change anything about how we did that? And that's the strategies. That's where I see. Oh, amazing. And thank you for teaching me and my husband. Moving on. And of course, it's all in the brain. There's the hypothalamus telling the pituitary gland, go send down sex hormones. And hormones can change with MS or without. But for sure, I'm glad we had the docs on to talk about it. Next slide, please. Oh, that's from one of my patients. Okay. Isn't always like that, but that was his joke. Moving on. And of course, we had people talk about the spine and the chest muscles and the breathing. And this is so important in sex. And that's why tantric sex, when I talked about it, eye gaze, breathing, body mapping, that closeness, by the time you get to genitals, maybe they'd work, maybe they wouldn't, but you'd be close. Tantric sex. Moving on. And we look at men as well. And we see what can happen. That if the guy retrogrades ejaculate, when it gets to the prostate, it will go back in the bladder, not come out of the penis. And some guys, if they use that ring, it's going to go on the base of the penis to hold it as well. So you want to see about your body. Next slide, please. By the way, if a guy doesn't have MS, sometimes they are better if they stand up to ejaculate. Just saying. You want to know about these outside parts. You want to know if there is a reduction of the clitoris. You want to know if there's atrophy, dryness. You want to see what can help with that. Moving on. And some people ask me about the G-spot. Okay, we got to end pretty soon, but the G-spot is 1 or 2 fingers in the vagina, and if it's not, if it's not lubricated, woohoo, but it's toward the tummy, which means it's toward the bladder. And the G is named after Dr. Grafenberg, all very medical. So some women don't like that G-spot rubbed at all because they feel like they have to pee. And for some women with MS, like, don't get me there, all right? Just saying, that's why you communicate. Moving on. And here, we talked about this. I know that many of your people talked about this already. The parasympathetic, the sympathetic. I like a little harder, softer. Ooh, I used to like this, but it's too painful now. All right, let's see what's possible with that. Relax, recoup, breathing, absolutely. Moving on. So, all right. You ready for good news? Moving on. The power of psychogenics, which I know people have said. Thoughts, fantasies, sights, smells, tastes. That's the sensuousness. Words, touches. How can we reframe our sensuousness? Moving on. And I'm feeling this. I'd like this. I don't want this. Let's talk. Let's think. Let's see what works for us. Every couple's different, and every single person is different living with MS. Okay, moving on. Well, not everybody has an orgasm if you just come out of your shell. And that's why information about MS is so important. Moving on. Here's one sex response cycle, Masters and Johnson's. Not everybody has high desire, but some people do. Next slide, please. And here's the two Berman beauties who worked with a lot of people. Next slide, please. And that's the Rosemary Basson model. And I just want you to see before we end this, do you see sexual neutrality? You can enter that. And some people get more aroused with emotional intimacy or touch of certain body parts mapping. All right, moving on. We're coming to the end. 5 types of touches. Let's observe now and see as I'm living with MS. Let's see about playful, nurturing, sensuous of the senses, sight, smells, taste, touch, and then sexual. Moving on. Eve's Garden. You can get some toys there. Moving on. And there's the toys. And do you see what they put? Enjoy Me? You get a 10% discount if you put MV69. That's Marilyn Volcker. Oh, I didn't even know that. Okay, next slide, please. Okay, well, not everybody can drink. And many people still can have multiple orgasms, especially with toys, too. Moving on. And if there's fear of failure, certainly that can affect. Go and see a sex therapist or a doctor or pelvic floor who understands MS. Moving on. And if you're depressed, I get it. Oh my gosh. Oh my gosh. And so people who are depressed don't want to feel like they have sex. They do need help though with depression. Moving on. Sexual pharmacology. That's what I heard one of the speakers talk about. Moving on. And you have to let your doc know what is happening with any of your medications. Absolutely. Moving on. By the way, patients have sent this to me. You can see where there's a lot of concerns about sexuality. Moving on. By the way, you will have this. That's that G-spot. Moving on, we talked about. Moving on. There's the G-spot. Good vibrations. They have a lot of toys. Moving on. And there's the vaginismus. If a woman is scared or, those spasms. Absolutely. Pelvic floor therapists can help too. Moving on, and breathing. I liked the breathing. There's the soul source. Graduated dilators. Moving on. These are all sent to me by people with MS that said they could help. Didn't help everybody, but clitoral therapy that would bring the blood flow more. Moving on. Viacrine, you have to be careful what you put in a vagina. So check what's in it. Moving on. And here, this is called the pump. And, okay, it can bring the blood flow, and then you put that C-ring. Okay, and you're seeing what pros and cons. Moving on. And there's the vacuum device, it's called. And see, you can see the C-ring at the base of the penis. Moving on. And here's, well, it's an EpiPen now, but self-injecting as well. And that is the only way my husband gets an erection. Absolutely. I'm glad I learned from all of you. Moving on. And this is the penile implant. Some people decide to get that. Talk with your doc. Moving on, because it is a major surgery, major, okay, where you pump one side of the scrotum, you get the erection, okay, and then boom, then other side, and the saline solution will come back. Moving on. I just want to be sure. So here's a good place to end. Take care of yourself. Find the best time and place to body connect. Sex might happen. Change your position on sex, both emotionally and physically. And expectation. Take what comes. It's a joke about what comes or doesn't. Okay. Music might be on. Show what you like. Share what you like. Don't expect a partner to read your mind. This is all from people with MS. Let sex be human. Stop when you want. Bring in toys. Try something different and then evaluate. Look at partner with eyes of love and empathy. You're both going through things. And if you're single, you want to find people that are going to be flexible. All right? Think about how drugs or alcohol or meds affect. Get out of the fast lane. Sex is not a track meet. And so those 5 types of touches, celebrate the 8 types of intimacy. Make your own stats. And from the real experts on your sexuality. I'm so amazed and honored to be a part of this conference. Thank you for letting me go. Oh, much farther than I was given.
Thank you, Marilyn. And again, from the international community, we say thank you. And everybody that's on here knows that we needed to let Dr. Volker speak longer because, yeah, we needed to make it all longer for her, all right?
They might have already gone to lunch. It's okay.
Well, people are here. There's still a lot of people online. I'm very happy to say, all right? And that's great. So we have questions to ask you that were given to us ahead of time, and there's questions to ask now. And I lost the ones that I just had now. I don't know where the question went. All right, I'm pulling that back out again. Yes, I'm elongating it again, all right?
Yes, it's all right.
Okay, great. All right, first one. How, well, a woman wants to know about that shot in the penis. She says, isn't an EpiPen something for allergies? And is that what you're saying, that the penis is not enlarging because of an allergy, or is it something else?
The penis may not be enlarging if it's from MS because of blood flow, just as in my husband's case, or when I've worked with people with diabetes, it's about blood flow. That's what makes a penis large, blood flow. So if there's a neurology problem or blood flow problem, that is, years ago when they came out with it, it used to be the needle, like the needle of and guys didn't like that. The EpiPen makes it a little more
tolerable,
workable. No guys like the idea. But if you didn't get an erection for the rest of your life and you might want to check with your urologist who understands MS. Okay.
I don't think my urologist would recommend that, but it's okay. All right. Next. You have to
also know, by the way, Mr. Schlossman, is you have to also know what's in it. And, the papaverine, registine, prostaglandins, and also how is that going to mix with whatever medications you're already taking?
Yeah, I would imagine so. I would imagine that would be a very exciting subject to talk about. Okay. All right. Next, a person wants to know about the retrograde orgasm. Is this dangerous to the body? I mean, he feels that if it's going back in, then what's happening with that?
Thank you. I appreciate it as well. If it was going back all the way up in the body, okay, that may be a different story. But when it retrogrades, it goes in the bladder and it's broken down. So you urinate it out. You don't see it. It's not going to be white like semen. But no, it's not harmful. It's just a way for the body to actually say, I'm retrograding rather than coming out of the penis. I've never seen a piece of research that has said it was harmful as well.
Okay, thank you.
It happens to a lot of guys. It happens to a lot of guys with a lot of diseases or meds. Yes.
Say that again. What was mixed?
It happens to a lot of guys with diseases or meds. Some of the meds can create medications. Can create that retrograde. But I've never seen any research, but talk to your doctor, talk to your urologist who knows about that.
Okay, great. So something everybody should know, if you have a question to ask I am not going to say not even your first name during this segment, okay? Maybe that'll get some of you to open up, okay? A person writes, my first education within a CAP course. I don't understand what CAP is. Now sex and MS. Thank you from this person with the initials. I'm not saying. Okay, never mind. Okay, anyway, this person is saying thank you very much.
Oh, right. You're welcome. This is sign language for you're welcome. And we all need to be able to share what our sexual system is about. It's very honorable, very honorable.
Okay. Next person. I'm the one with MS. My husband is my caregiver as well as my husband. My husband is my caregiver as well as my husband. All right. He's no longer interested in intimacy and associates it with pain and my difficulties that I don't. He won't even discuss it. How can I get him interested again? It's been nearly a decade since he's touched her.
Oh, I understand. I understand.
She's got the MS.
Yes, she does. And he may be the one who's seeing, and some people, whoever the care providers, don't always associate a sexual feeling with being a care provider. Remember, that is his I'm going to say, his conflict. His conflict. I have great compassion for both of them. Great compassion. That's his conflict. And how can I be a care provider and yet see her as a sexual being? What she might be able to do, although 10 years is a long time, I've worked with couples who haven't had sex in 20 years, okay, is that you really don't want to just start with a sexual activity. You want to start with how can we be close in some way? Like if he's a care provider, is he okay rubbing her back? Is she, if it's not painful, is she okay rubbing his back or his leg? I wouldn't start with genitals. I would start with some kind of connection, and it takes time. Or holding a hand, or talking about, oh, I'd really like to kiss you on the cheek. Really like that. But you don't have to end in sex because of it. I think most people think, oh my God, if we start this, we got to end in sex. No.
Okay.
But that is a very common thing of people who are care providers. Thank you. It's a great question.
Okay. So the next one is slightly different. And this person is writing, so I am the one with MS, and I still have difficulty letting my partner know that I'm not in the mood or tired. How can I communicate to my partner so that he doesn't take offense or feel less interested in me and reduced desires?
Yes, it's what a lot of people who live with diseases really struggle with. I think the one thing, if you can figure it out with a support person, when is your best time to be touched and where? Body mapping. Remember, you do not have to have high desire. Remember that Rosemary Basson model. You can enter body connection in neutrality and see what you really like. It doesn't have to feel sexual. It doesn't. What would you really like? And he might like something else. You're right. However, the timing of it is really important, of when I can best give and when I can best receive. And boy, it doesn't have to be 50-50. I've seen lots of couples go, oh, your turn tomorrow at this time. Yes.
Okay. Next one. This is from what I received when a person registered. For more than a year, I've been unable to ejaculate during intercourse due to decreased sensation in my penis. I'd like to know if this is common and what others may have done to deal with it.
Thank you very much. And first of all, I just want to say on that last question, I hope that particular woman gets help and support too. Help and support in communicating that as well. To this particular gentleman, it's very common that a guy could have an orgasm without ejaculation. Am I hearing that correctly, Stuart?
That what?
Did I hear that question correct?
If you heard that for more than a year I've been unable to ejaculate during intercourse due to decreased sensation in my penis, if that's what you heard, then yes, that was correct.
That's it. Okay. The question would be, intercourse doesn't always create the sensations. I would first ask if this gentleman is masturbating by himself.
Well, he's asking also, hold on a second, he's also saying, I'd like to know if this is common and what others have done to deal with it.
Okay. It is common. It is common. If the only reason I'm asking this is if he's masturbating by himself, okay, his brain is interpreting, am I sitting? Am I standing? Am I looking at something? Okay, visually, what is the tension of my hand? Okay, my question would be, can he ejaculate by himself? Therefore, if he can ejaculate by himself, you want to then include that. Okay, so if he's sitting and masturbating, maybe the couple could integrate the sitting and partner's hand on his hand to learn the tension. And this is called sex therapy. We go step by step by step. It's like some women who can only have an orgasm with a toy. Okay, then you bring the toy in. My question would first be, can you ejaculate by yourself? And if you can, then I hope that you could integrate some of place, time, okay, and tension to be able to ejaculate. I hope you'd see a sex therapist sometime. Doesn't have to be me, but there are many people who are well qualified.
So that leads to another person's writing that he didn't use the word masturbate, he used the word play with himself, but that there are times that he plays with himself that he's able to reach orgasm, and there are other times that he plays with himself and he finds that he's doing that for a few minutes and then he just loses all sensation and then just stops, gives up, walks away. What do you say to him about that?
Well, he's finding out about his body. Let me just say, I would not want anybody in masturbation or sex where it becomes work. We all work at work. But when that becomes work, you're learning about your body living with MS. And that is a normal thing too. I start and then, I don't know, I lose interest or my brain goes somewhere else or I lose the erection. Okay. Was it pleasurable? That would be my question. Was it pleasurable at the time that you were starting to do this or masturbating? Was it pleasurable? Once you get past pleasurable and it's work, because that's going to be the end feeling. You want to come out feeling relaxed. Ejaculation and orgasm, your body gives off these morphine-like feelings. Usually, if there's not pain, and there could be, but if there's not pain, you feel relaxed. If you had to work at it, I would stop at a certain time, and then what was pleasurable? What was?
Okay. Next, from a person online. I haven't been able to have an orgasm for years, but I want to. Can you please help? This is from a woman, and that's all I'll say about that.
Okay. All right. A lot of women, the first thing would be, did she ever have an orgasm? How did she have an orgasm? Was it by her hand? Was it by a toy? Was she sitting up? Was she on her tummy? Was she, see the position and the intensity. Was she thinking about a fantasy about somebody? Because our fantasies can also include. Some women say, I like to read material. I like to read sexy material. Okay, that's great. Or I like to look at a sexy movie. Okay. And so that part, I'd like to see when she was able, now with MS, it can shift and change the intensity of either a toy or a pelvic floor therapist that can help with the biofeedback of the muscles, okay? That could help as well. And I've seen that happen, but don't give up. Oof, don't give up. I always tell people, it could be small little butterfly, by the way, sign language for butterfly. It could be small little butterfly orgasms. Mm-hmm.
Okay, we have 6 questions remaining, okay?
Okay.
All right, so the next one, how do hormone levels, an example of menopause, affect libido in MS?
Oh, first of all, hormone levels affect libido, period, okay? And that would be important to get hormone levels checked, absolutely. And don't only blame it on MS. And I'm not being rude about living with MS, because it certainly can affect desire and interest. However, there are many women, I don't know the age of this person, there are many women who, when they get to a certain age and the hormones are lower, then they go, I don't have the desire. Now my question would be, do you have the desire to be close in some way? That would be an interesting question. Do you have the desire to be close in some way? Because that's desired as well. Body closeness, emotional closeness, holding hand closeness, looking at movie closeness. Oh, yeah.
Okay, so the person just asked if when you responded about the EpiPen, did you mean an auto-injector?
Yes.
Okay, thank you. So guys, she's talking about an auto-injector, not an EpiPen, all right? We don't have to worry about allergies.
Yes.
Okay.
Yes. And you
all
know,
right.
and by the way, that would be something to really talk to your urologist about and find out what's going in your body. And remember, everything doesn't work the same for everybody. Not Viagra,
Right.
not Cialis, not the pen, that part.
Okay, that leads to a question. It was asked of us at another program, and we didn't get to respond or ask the doctor about, but for people who have arrhythmias and having an issue with getting an erection, are they allowed to use like a Cialis or a Viagra, or is that something that becomes a big no-no?
I would say you'd have to talk to your doctor who knows MS, and you'd have to see the meds that you are taking with that. Remember, a Viagra or a Cialis is a vasodilator. That's a vasodilator. How would that affect the vasodilating of the whole system? That would be my question to the doc with the medications that are being taken. And by the way, even if it would be okay, a Viagra may not work for everybody, or a Cialis may not work for everybody. The reason Cialis came was, of course, you could take a lower dose every day, and then you wouldn't have to like, okay, I just took this, we got to get this on in an hour. And it got to be performance anxiety. Holy cow. Oh, my God.
Okay. All right, next question. Person writes, my hubby is my caregiver. He had his prostate removed. He does not have a desire to have sex. I have the desire to have sex. We've been married for 45 years. What can you suggest?
Oh, you know, and remember, things are going to change for some people, but not for others. When some people have their prostate removed, and if it was because of cancer, okay, then they may be dealing with, what does that mean? Oh my God, if I had cancer. Or, oh my God, if I don't have a body part. And remember, the prostate is a really sensitive part on a man's body. And that part, if it's gone, he may not feel that same sensation. So he might want to be close in some ways, but it's not going to feel the same. And he's going to have to deal with what that's about. I would say, I would hope, and I'm grateful she still has desire. This is the partner, right? And that's really great. Now you have to see, how would people want to be close? That's why I like to see people go to a sexologist who knows MS and care partners, because there could be a number of things involved in that. Let me just say, if somebody's washing a body and it's for hygiene, or if somebody has a bowel or bladder accident and it's for hygiene, they may not see that as sexual. So you want to find the place and time of closeness. I'd like to see how he would want to feel close, because that's the first steps in moving toward. And by the way, he doesn't have to have the same high desire that she does. As long as they're respectful. A lot of people think guys have always more high desire than women. Not necessarily.
Okay. Next. Since my diagnosis 8 years ago, I've lost interest in the intimacy area. I am also menopausal, so that's another barrier. How can I get my libido back? And how can my husband and I share intimacy if sexual intercourse is too painful for chronic bladder issues?
Oh, thank you. First of all, I want you to look at the PowerPoint with the 8 types of intimacy. I want you to look and see what you do want to share in those 8 types. Second of all, if you noticed on sex, it's an outer and inner. Outer course is anything by hand, by mouth, by toy. And a lot of people, when intercourse is too painful, or they don't want that, but they still could do any kind of closeness by hand, by mouth, by toy, and you see what's going to work best for you. Everyone is different in this area.
Okay, thank you. Another question that just came in: are virtual visits available with a sexologist?
Yes. Oh, yes. We train a lot of sexologists under the auspices of Dr. Carol Clark and all over the world. And so people are certified and they get their doctorates. But yes, the answer is yes, you can have virtual. Absolutely.
Okay, great. Before I get to the last question, I want to let everybody know that Dr. Volker has mentioned that if you see a certain slide, well, the bottom line is when we publish this video, you can watch it and you can stop it at your leisure at a slide, and you can read it and then just click to continue the video going. All right. So that way you can see the rest of the video, but you could start, stop, pause, do whatever you want. You have to take a pee break. You'll be able to do that and get back to it again. All right. Okay. Or if you could stop and get your significant other to come to, and watch it as well. All right.
And have that discussion. And by the way, if there's a question, my email is on there. I'm welcome to absolutely and clarify some things. Every couple's different. Every individual's different.
Right. And I want to thank, I will say this name, Christy just wrote, Stuart, I have to sign off. Just want to say thank you for your dedication to the fellow MSers. I've been to your conferences in the past and enjoyed today's. Take care. All right. Well, thank you, Christy. And everybody should know that we have great programs, all right? Bottom line is you should be watching everything we do.
And this is sign language for stars. Stars to you.
And you have to remember butterflies.
Yeah.
All right. All right. Next, and this is, I think it's the last one. Very interested to learn more about the relationship and intimacy part of life with MS. It's one of the more difficult things I struggle with. Can you say anything about this, please?
I want you to Google, because when I started 50 years ago, there was like one little paragraph. which was good to include. But now you can Google and you can see women's support groups, men's support groups, couple support groups talking about this and about MS. Google sexuality and MS. And wow, there are so many resources now that I'm grateful. I am so grateful that people are talking and sharing. And oh my gosh, that's really, really important because then you don't feel alone and you will be validated. And there will be things that are different. However, you still will be validated as that. So yay to the MS national, international groups. Yay, congratulations. Oh, and thank you, Stuart and Bill, for...
Great, thank you. I do have one more question for you. And Lisa, thank you for your kudos as well. And we appreciate hearing that. For anybody who's written in that they had some audio problems, we can't help that. There are no audio problems from our end, all right? It could be weather in your area. It could be the connections in your area. Could be that your area has slow internet, okay? And if there's too many people on the internet in your area, well, that would cause these problems as well, okay? So all I can say is sorry about that. And you'll be able to watch this online and be able to see that everything was crystal clear, okay? All right, next question. I have a hard time with energy being so low. I've had a hard time staying in the moment and staying fully there, especially during intimacy moments. Do you have any thoughts?
You know, thank you. I appreciate it. One of the things is when you're assessing that I can stay focused for whatever, 5 minutes, and it's okay, doesn't make you bad. I can stay focused for 5 minutes, and then I either need a break or TBC, to be continued. Now, that may be hard to say. However, I always ask people in a coupleship, would they want honesty? They may not always like it, understand it, or like always to do it. However, I can stay, one of the women said that, she said that when I was working in a coupleship with, she and her husband, she had MS, and she said, I had to find the right time, the amount of time, and she said, all of a sudden, we could do quickies, and I was okay, and he was okay. And I'm saying, well, I'm glad that worked for you, because her honesty about that, and that's why sometimes it helps if there's a counselor to ask the questions, because it helps then a person who's listening to hear and to be validated. Oh, yeah, that's pretty normal. And also, how is that for you, partner? And so we get to talk about feelings on both sides. Yes. Yes. He liked quickies, by the way. He liked quickies.
Well, Marilyn, thank you very, very much for your elongated session. And yes, it was fabulous. In fact, again, so many people were saying, I wish I had more time. We need parts 2 and 3 with Marilyn. All right. So we'll have to get you back on the air sometime, and maybe we'll get more intimate with it. Okay. And get more involved. All right. So, but you are the final speaker of the day. I do want to thank you. The world thanks you as well. And again, you know, for everybody that's been there, you know, we have a lot of programs coming up. We are doing between classes on Pilates, yoga, and physical therapy every month. We also are doing 8 virtual programs a month. We have gotten back into doing live in-person programs in various portions of the United States. So if you want to know more, you have to open up the emails that we send to you, all right? And you'll see about the programs. Or you could just visit the MS Views and News website, and you could stay in touch just from that. Just visit there every couple of weeks, and you'll see the information for all the different programs that we have. Get registered for those that you want to watch. And again, I want to say thank you to everybody. I want to, of course, say thank you again to Bristol-Myers Squibb, all right, as they are our sponsor for this event. And so again, saying goodbye to all of you. Have a great day. Stay safe and stay in touch with those around you. Bye-bye.
Happy sexuality. Bye-bye.
Happy sex.
There you go.
Great one. Smile.